Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of men, starting with the letter T. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints. Then ailments of the esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, and ailments specific to women and specific to men. Then issues of the hormones and the metabolism. And after that, I'll address the issues of homeopathic remedies on infections, infestation, and the immune system, and surrounding fertility, pregnancy, childbirth, postnatal problems, homeopathic remedies for infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories, called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of men, starting with the letter T. This section covers those disorders that affect the male reproductive organs. Infections are the commonest kind of disorder that affect the male reproductive system. For although the male urethra is relatively long and less prone to invasion than the female, it has direct communication with the testes, epididymis, and prostate. This means that kidney, bladder, and urethral infections can spread to the organs concerned with male reproduction. The testicles manufacture sperm and also produce the male sex hormone testosterone. They lie outside the body because sperm production requires slightly cooler conditions than those that occur inside the body. And the left testicle is usually lower than the right one. Normally, both testicles descend into the scrotum, which is the pouch of skin behind the penis, shortly before birth. At puberty, they enlarge and begin to produce sperm. Each testicle consists of an almond-shaped testes, where sperm are manufactured at the rate of 10 to 30 billion a month, and a much coiled tube called the epididymis, inside which the sperm mature for about 3 weeks. In all, it takes 60 to 72 days for a sperm to develop fully. From the epididymis, sperm move into the vasa deferentia and seminal vesicles for storage. In the seminal vesicles, a sugar-rich fluid is added to provide the sperm with energy. If mature sperm are not ejaculated, they disintegrate and are reabsorbed into the body. But if ejaculation does occur, the seminal vesicles and prostate gland contract powerfully, expelling about a half teaspoon of semen into the urethra and out of the end of the penis and into the female reproductive tract. Sperm have a maximum life of 3 days. It is not possible to urinate and ejaculate at the same time because the reflexes that cause the bladder to empty automatically shut off entry of sperm into the urethra. The prostate gland is a bulb-shaped and completely encircles the urethra at the point where it leaves the bladder. Its role is to add acids, trace elements, and enzymes to seminal fluid at the moment of ejaculation. These activate the sperm and also give semen its distinct smell. For reasons that are not known, the prostate tends to enlarge and stiffen with age, narrowing the exit from the bladder. This obliges the bladder muscles to work harder to expel urine and can make urination slow and painful. The penis relies for its hydraulic power on 3 cylinders, 2 hollow and 1 spongy. These are arranged protectively around the urethra and only fill with blood during sexual arousal. Erection is maintained by strands of muscles at the base of the penis that slow the rate at which blood drains back into general circulation. The head of the penis is most sensitive to touch, and the shaft of the penis is most sensitive to pressure. Thrush. Thrush is a fungal infection mainly found in women, but occasionally in men if genital hygiene is poor or the sexual partner is infected. The yeast grows under the foreskin of the penis, causing itching and inflammation. The conventional treatment consists of antifungal cream. Specific remedy, to be taken 4 times daily for up to 14 days. Mercurius, 6C. Trichomoniasis is caused by the trichomonias organism that lurks under the foreskin of the penis, causing soreness and inflammation. This condition is far more common in women than men and may be the result of poor hygiene or intercourse with an infected partner. Urethritis is an inflammation of the urethra, often caused by infection transmitted during sexual intercourse. The symptoms are a burning sensation when urinating or ejaculating and a thick yellow discharge from the tip of the penis. Refer to my video on cystitis under the concerns of women, homeopathic videos, and sexually transmitted diseases. Gonorrhea and nonspecific urethritis for conventional and homeopathic treatment, and self-help measures. Intercourse should be refrained from until symptoms disappear. Repeated infection can cause urethral strictures. Urethral stricture is a rare condition in which the urethra becomes narrowed by scar tissue as a result of injury or infection, making urination and ejaculation painful or impossible. Shrinkage of the urethra may also force the penis into a bent position. Occasionally, the urethra may narrow as the result of nervous spasm. If the homeopathic remedies that follow do not improve matters, see your doctor. The urethra may have to be stretched under local anesthetic, or scar tissue may have to be incised or replaced with a graft. Specific remedies. To be taken every hour for up to 10 doses in acute cases. Painful spasms during urination, tingling or smarting sensations when not urinating. Use Aconite, 30C. Self-help. Bathe the penis in cold water twice a day. The easiest way to do this is in the shower. Avoid spicy foods and take a 3-week course of vitamin E, gradually increasing the dosage from 100 units to 600 units a day. Testicle and scrotum problems. Testicle and scrotum problems can be detected early by regular examination of the testicles, preferably in a hot bath so that scrotum muscles are relaxed. The testes themselves should feel smooth through the skin of the scrotum. The epididymis should feel cord-like, with no noticeable bumps or lumps. Any nodes or areas of tenderness or swelling should be reported to your doctor. Enlarged or painful testicles. A painless lump in one testicle is most likely to be an epididymal cyst. In rare cases, it may be cancer of the testicle. A painful swelling in one testicle followed by pain and swelling on the scrotum suggests torsion of the epididymis. Both conditions require prompt medical attention, so see a doctor within 2 hours. A blow to the testicles can cause severe pain. If the pain does not wear off within an hour or so, or if the scrotum is obviously bruised and swollen, see a doctor within 2 hours. Surgery may be necessary to prevent internal bleeding and permanent damage to the testes. In the meantime, give arnica 30C every 5 minutes for up to 10 doses. Epididymal cysts are benign, painless, fluid-filled swellings that develop in one or more of the many tubes leading from the testes to the epididymis. It is quite common in men over 40 and can occur in one or both testicles. Since the epididymis lies behind the testes, swelling is usually located in the upper rear part of the testicle. Surgery is seldom necessary or advised, as it can result in partial sterility. Constitutional homeopathic treatment is recommended, but the remedies below that should be tried first. Specific remedies to be taken 4 times daily for up to 7 days. The remedy of first choice is Apis 30C. If Apis does not reduce the swelling, use Graphites 6C. Epididymitis is a bacterial infection of the epididymis, usually as a result of a urinary tract infection, which results in hot, painful swelling at the back of one testicle. It is conventionally treated with antibiotics. However, the remedies that follow should be tried first. If there is no improvement within 12 hours, see your doctor. Specific remedies to be taken every hour for up to 10 doses. Testicle extremely hot, red, swollen, tender, and sensitive to the slightest jarring. Use Belladonna 30C. Infection onsets very suddenly, dramatic swelling of the testicle, pains in the scrotum and lower abdomen. Use Pulsatilla 6C. Fever, restlessness, infection comes on after exposure to cold, dry winds. Use Aconite 30C. Testicle hot, swollen, and aching, as if someone had kicked it. Pain shooting up towards the bladder. Use Hamamelis 6C. Hydrocele results from excess fluid in the double-layered sheath around the testes, causing soft, painless swelling. In most cases, the cause is not known, though occasionally this condition is precipitated by injury, most common in older men. This condition usually kept under observation rather than treated, but if the swelling is large, the doctor may recommend drawing off excess fluid under local anesthetic. If this does not prevent recurrence, surgery may be necessary. If the homeopathic remedies that follow produce no improvement within a month or so, see your doctor. Specific remedies to be taken 3 times daily for up to 3 weeks. Swelling follows injury. Use Arnica 30C. If arnica does not help, use Bryonia 30C. Testicle tends to ache in thundery weather. Use Rhododendron 6C. Torsion of the testicles occur when one of the testicles twists out of its natural position, pinching veins and blocking the outflow of blood. The result is a sharp pain, sometimes sharp enough to cause nausea and vomiting and swelling. This condition is rare, but can happen at any time, even in sleep, in susceptible individuals. The double-layered sheath enclosing the testes is not as close-fitting as it should be. The twist often undergoes itself spontaneously, but if it doesn't, see a doctor within 2 hours, as arteries as well as veins may become blocked. While waiting for medical help, take Aconite 30C every 5 minutes for up to 10 doses. The standard treatment is surgical exploration, as this is the only sure way to prevent torsion from recurring. Varicocele is the abnormal distension of veins draining one of the testicles, very similar to varicose veins in the legs. The symptoms are swelling, which disappears when lying down, and a dragging pain, especially in hot weather or after exercise. This problem is most common in adolescents. In rare cases, an increase in local heat can interfere with fertility. The pain and dragging sensation can be relieved by supporting the testicles with a jock strap. Surgery to remove or bypass distended veins is not always successful. Specific remedies to be taken 4 times daily for up to 21 days. Person pale and anemic, pain made worse by pressure but relieved by cold applications. Use Ferrum Phosphate 6C. Pain radiates up from testicle into the lower abdomen. Person also suffers from piles. Use Hamamelis 6C. Heat and lying on painless side makes pain in testicle worse. Cold applications relieve the pain. Use Pulsatilla 6C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.